In the beautiful journey of motherhood, every step is precious, every moment cherished. But for women navigating the path of pregnancy with type 1 diabetes, the journey takes on an added layer of complexity and courage. Welcome to a world where resilience meets love, where science intertwines with the miracle of life. Imagine the tender flutter of a baby's first kick, the joyous anticipation of meeting your little one. Now, imagine balancing these dreams with the constant vigilance required to manage a chronic condition like type 1 diabetes. It's a delicate dance of monitoring blood sugar levels, adjusting insulin doses, all while nurturing the precious life growing within. We will explore the intricacies of type 1 diabetes and pregnancy, delving into the physiological changes, potential complications, and strategies for successful management. Through a combination of medical insights, personal stories, and expert advice, we aim to provide valuable guidance and support for women embarking on this extraordinary journey. Number 1. Preconception care. For women with type 1 diabetes involves optimizing their health and glycemic control before becoming pregnant to minimize the risk of complications during pregnancy. The primary focus is on achieving target blood glucose levels through adjustments in insulin therapy, dietary modifications, and regular exercise. This helps reduce the risk of birth defects, miscarriage, and other adverse outcomes. Healthcare providers review the woman's current medications to ensure they are safe to continue during pregnancy or may need adjustments to minimize potential risks to the developing fetus. Folic acid supplementation is often recommended before conception and during early pregnancy to reduce the risk of neural tube defects in the developing baby. Women undergo screening for complications associated with type 1 diabetes, such as diabetic retinopathy, nephropathy, and cardiovascular disease, to identify and address any potential risks that may affect pregnancy outcome. Preconception care aims to optimize the woman's health and minimize the risk of complications during pregnancy, promoting a safer and healthier pregnancy for both mother and baby. Number 2. Tight glycemic control. In the context of type 1 diabetes and pregnancy, tight glycemic control is essential for reducing the risk of complications for both the mother and the developing fetus during pregnancy. Tight glycemic control involves frequent monitoring of blood glucose levels, often several times a day, to ensure they remain within target ranges. Women with type 1 diabetes may require adjustments to their insulin regimen to accommodate changing insulin needs during pregnancy. This may involve multiple daily injections of insulin or the use of insulin pump therapy to provide continuous insulin delivery with greater flexibility. Following a balanced diet that includes a consistent intake of carbohydrates, proteins, and fats is crucial for stabilizing blood glucose levels. Engaging in regular physical activity can help improve insulin sensitivity and promote overall health during pregnancy. Continuous glucose monitoring systems provide real-time data on blood glucose levels, allowing for proactive adjustments to insulin therapy and lifestyle factors to maintain tight glycemic control. Regular prenatal visits with healthcare providers specializing in diabetes management and maternal-fetal medicine are essential for monitoring maternal and fetal well-being, adjusting treatment plans as needed, and addressing any concerns or complications that may arise. By closely managing blood glucose levels through a combination of insulin therapy, dietary management, and regular monitoring, women with type 1 diabetes can optimize their chances of a healthy pregnancy and delivery. Number 3. Antenatal screening and monitoring. For women with type 1 diabetes during pregnancy involve various assessments to detect and manage potential complications. Regular monitoring of blood pressure helps detect gestational hypertension and preeclampsia, which are more common in women with type 1 diabetes. Urine tests are performed to check for proteinuria, a sign of kidney damage and potential preeclampsia, which can occur more frequently in diabetic pregnancies. These scans are used to monitor fetal growth, assess amniotic fluid levels, and detect any abnormalities or signs of fetal distress. Women with type 1 diabetes may have more frequent ultrasound scans to ensure the baby is growing adequately and to detect any issues early. Women are often encouraged to monitor fetal movements regularly, as changes in fetal movement patterns can indicate fetal well-being. Antenatal screening and monitoring for women with type 1 diabetes aim to identify and address potential complications early, allowing for timely intervention to optimize maternal and fetal outcomes. By closely monitoring various parameters throughout pregnancy, healthcare providers can help ensure the safety and well-being of both the mother and her baby. Number 4. Labor and delivery management. Type 1 diabetes involves closely monitoring blood glucose levels and adjusting insulin therapy to maintain stable glycemic control throughout the birthing process. Labor and delivery management for women with type 1 diabetes involves closely monitoring blood glucose levels and adjusting insulin therapy to maintain stable glycemic control throughout the birthing process. Obstetric assessments, including fetal heart rate monitoring and regular checks of maternal vital signs, are conducted to ensure the well-being of both the mother and the baby during labor. Labor and delivery management for women with type 1 diabetes often involves a multidisciplinary team. Effective management of labor and delivery in women with type 1 diabetes requires close collaboration between the healthcare team and the expectant mother to ensure the best possible outcomes for both mother and baby. Number 5. Postpartum care. Postpartum care for women with type 1 diabetes and pregnancy is essential for ensuring their well-being and managing potential complications. Continuous monitoring of blood glucose levels continues postpartum, as hormonal changes and breastfeeding can affect insulin requirements. Insulin doses may need adjustment postpartum as insulin requirements change. Healthcare providers closely monitor blood sugar levels and adjust insulin doses accordingly to maintain stable blood glucose levels. Breastfeeding is encouraged for women with type 1 diabetes as it offers benefits for both mother and baby. Family planning discussions are crucial postpartum to help women make informed decisions about contraception. Healthcare providers offer guidance on contraceptive options that are safe and effective for women with type 1 diabetes. Regular postnatal follow-up appointments with healthcare providers are scheduled to monitor maternal health, assess blood glucose control, and address any concerns or complications that may arise postpartum. By providing comprehensive postpartum care, healthcare providers can support women with type 1 diabetes in achieving optimal health outcomes for themselves and their babies following pregnancy. Thank you for joining us on this insightful journey through type 1 diabetes and pregnancy. Remember, knowledge is power, and by understanding the intricacies of managing diabetes during pregnancy, you are better equipped to navigate this remarkable journey. If you found this video helpful, don't forget to give it a thumbs up, share it with others who may benefit, and subscribe to our channel for more valuable content. Together, we can empower and support women on their path to healthy pregnancies and joyful motherhood. Stay tuned for more informative videos. Until next time, take care and stay healthy.